Let's look at 10 NCLEX prioritization questions. Question number 1. A nurse enters the room to begin a nursing admission assessment or history. The patient is grimacing and reports severe pain. Which action should the nurse take first? A. Postpone the full interview until the pain is completely gone. B. Give prescribed pain medication before asking any question. C. Ask rapid yes or no questions to complete the history quickly. D. Ask only focused questions about the current problem and finish the full history later. Okay, the correct answer is letter D. Ask only focused questions about the current problem and finish the full history later. This is the reason. The nurse should not ignore pain, but the nurse still needs enough focused information to understand the immediate concern. A complete health history can wait until the patient is more comfortable. Question 2. While completing a health history, the patient says, "I am so tired, I can barely keep going." What is the nurse's best response? A. End the interview and leave the patient alone to rest. B. Schedule another time to complete the rest of the interview. Letter C. Ask more questions about fatigue before stopping. D. Reassure the patient that treatment should help soon. Okay, y'all, the correct answer is letter C. Ask more questions about the fatigue before stopping. The rationale. Severe fatigue may signal a clinical problem. The nurse should gather focused information about onset, severity, associated symptoms, and impact before deciding whether to pause the full interview. Question number 3. The nurse is planning health promotion teaching for a group of middle-aged adults. Which topic should receive priority? A. Smoking cessation. B. Prevention of infection. C. Avoid all alcohol use. Or D. Lowering high-density lipoprotein levels. Okay, so the correct answer is letter A, smoking cessation. This is the rationale. Smoking cessation is a major priority because it reduces risk for cardiovascular disease, stroke, lung disease, and several cancers. Let's go to question number 4. A 93-year-old nursing home resident has been eating less during meals. Which nursing intervention should the nurse try first? A. Replace the meal with a nutritional supplement. B. Feed the patient until the entire meal is finished. C. Give the patient extra time to finish eating. D. Request evaluation for gastrostomy tube placement. Okay, so let's look at the correct answer. The correct answer is letter C. Give the patient extra time to finish. And this is the rationale. Older adults may need more time to chew, swallow, and complete meals. The least invasive patient-centered action is to allow extra time before escalating care. Let's go to question number 5. A patient develops a temperature of 102 after coronary artery bypass graft surgery. Which concern should the nurse recognize as the priority? A. Fever may cause diaparesis. B. Fever increases cardiac workload. Letter C. Fever indicates cerebral edema. Or letter D. Fever is a direct sign of hemorrhage. Okay, so let's look at the correct answer. It's going to be letter B. Fever increases cardiac workload. So after CABG, which is open heart surgery, fever increases metabolic demand, heart rate, and oxygen needs. This places extra workload on the heart during a vulnerable post-operative period. If you're new to this channel, if you could like and follow and share these videos with your friends. Thank you. Question number 6. An occupational health nurse is teaching employees how to lower the risk for work-related lung disease. Which prevention measures should the nurse emphasize as a priority? Letter A. Keep the workplace smoke-free for all staff. Letter B. Use proper respiratory protection and maintain effective ventilation. Letter C. Rely on regular workplace inspection by safety agency. Letter D. Schedule routine chest x-rays and pulmonary function testing for exposed workers. Okay, so the correct answer is letter B. Use proper respiratory protection and maintain effective ventilation. This is the rationale. The priority is reducing exposure to harmful airborne irritants. Ventilation and respiratory protection help prevent inhalation of dust, fumes, gases, and chemicals. Let's go to question number 7. A patient with stage 2 hypertension takes hydrochlorothiazide and lisinopril. Prazosin is added to the treatment plan. Which teaching point is most important? Letter A. Check weight each morning for fluid changes. B. Rise slowly and avoid standing for long periods. Letter C. Use sugar-free gum or candy for dry mouth. Or letter D. Check the pulse daily for a slow heart rate. Okay, so let's look at the answer. It's letter B. Rise slowly and avoid standing for long periods. This is the rationale. Prazosin can cause orthostatic hypotension, especially after the first dose or when the dose is increased. The patient should change position slowly to reduce dizziness, syncopal episodes, and falls. Okay, so let's go to question number 8. A nurse teaches a group of women about coronary artery disease. Which statement should the nurse include? Letter A. Smoking carries less heart risk for women than men. Letter B. Women usually seek care earlier than men when symptoms occur. Letter C. Estrogen therapy after menopause lowers the risk of coronary artery disease. Letter D. Coronary artery disease is a leading cause of death in women, and outcomes after myocardial infarction may be worse than in men. Let's go to Correct answer is letter D. Coronary artery disease is a leading cause of death in women, and outcomes after MI may be worse than men. And this is the rationale. Women have higher risk for CAD. They may have delayed recognition of symptoms and higher mortality after MI compared to men. Question number 9. A patient with chronic heart failure takes hydrochlorothiazide, digoxin, and lisinopril. Which finding is most important for the nurse to monitor to reduce the risk of digoxin toxicity? So let's go with letter A, heart rate, letter B, potassium level, letter C, blood pressure, or letter D, bowel patterns. Okay, so let's look at the answer. The correct answer is letter B, potassium levels. So remember, hydrochlorothiazide can lower potassium because this is a diuretic. Hypokalemia increases the risk of digoxin toxicity, so potassium monitoring is really the priority. Our next question. A patient's rhythm strip shows a regular rhythm, normal heart rate, normal P wave, normal QRS complex, but the PR interval is 0.26 seconds. What should the nurse do? A. Continue monitoring the patient. Letter B. Give atropine as prescribed by protocol. Letter C. Prepare for synchronized cardioversion. Or letter D. Prepare for temporary pacemaker placement. So the correct answer, y'all, is letter A, continue monitoring the patient. And why is that? Because this is first degree AV block. Prolonged PR interval with otherwise normal rhythm suggests first degree AV block. If the patient is stable, the nurse continues assessment and monitoring. Share in the comments how many points you got correct.